Phlebotomy Certification Exam Blood Culture Collection. Question 1. Before collecting blood cultures, why is careful skin antisepsis critical in the emergency department bay during a skills check? Option A. It reduces contamination that could cause a false positive culture. Option B. It changes venous blood into arterial blood. Option C. It makes EDTA tubes clot faster. Option D. It eliminates the need for sterile bottles. The correct answer is option A. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. Skin antisepsis does not change the type of blood collected. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Question 2. When collecting blood cultures with other tubes, which priority is most important in the physician office lab during a practice drill? Option A. Use a non-sterile transfer cup. Option B. Maintain sterility and collect cultures before non-sterile tubes. Option C. Collect cultures after gray tubes. Option D. Touch the bottle tops after cleaning to confirm dryness. The correct answer is option B. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. A non-sterile transfer process defeats the purpose of sterile collection. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. Question 3. If using a winged set for blood cultures, why is bottle order guided by facility policy in the community health screening event during a scenario? Option A. The order makes the needle reusable. Option B. The order determines the patient's identity. Option C. Air in the tubing can affect which bottle should be filled first. Option D. The order prevents the need to clean the site. The correct answer is option C. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Needles are single-use and cannot be reused. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Question 4. To protect patient safety, which action increases the chance of blood culture contamination? Option A. Collecting cultures before other tubes. Option B. Allowing antiseptic to dry. Option C. Using sterile culture bottles. Option D. Replicating the cleansed site with an unclean glove before needle insertion. The correct answer is option D. Replicating the cleansed site with an unclean glove before needle insertion. Touching the disinfected site with an unclean glove can reintroduce skin organisms. Collecting cultures first helps reduce contamination from other tubes. Allowing antiseptic to dry supports effective skin preparation. Sterile bottles help maintain specimen integrity. Question 5. After reviewing the order, which step is important after disinfecting blood culture bottle tops? Option A. Allow the disinfectant to dry and avoid touching the tops again. Option B. Place used gauze over the bottle tops. Option C. Blow on the tops to speed drying. Option D. Touch the tops with bare fingers to check them. The correct answer is option A. Allow the disinfectant to dry and avoid touching the tops again. Dry disinfected bottle tops reduce contamination risk during inoculation. Used gauze can contaminate the bottle top. Blowing can contaminate the clean surface. Bare fingers can reintroduce organisms. Question 6. For a patient with a small fragile hand vein, which device may improve control in the dialysis adjacent clinic during a study session? Option A. Unprotected straight needle used without a holder. Option B. Winged infusion set with appropriate tube or syringe technique. Option C. Large bore blood donation needle. Option D. Heel puncture lancet. The correct answer is option B. Winged infusion set with appropriate tube or syringe technique. A winged infusion set offers better control for small or fragile veins when used according to policy. Using an unprotected straight needle without a holder is unsafe and not standard practice. A large bore donation needle is excessive and can injure a small vein. A heel puncture lancet is for dermal puncture, not accessing a hand vein. Question 7. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first in the student skills lab during a structured exam prep drill? Option A. The discard tube replaces patient identification. Option B. The discard tube warms the patient's arm. Option C. The tubing airspace can underfill the citrate tube and disturb the blood-to-additive ratio. Option D. The discard tube removes EDTA carryover from the skin. The correct answer is option C. The tubing airspace can underfill the citrate tube and disturb the blood-to-additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. No tube can replace proper patient identification. A discard tube is not used to warm the arm. EDTA carryover is managed by order of draw, not by removing it from the skin. Question 8. If no blood enters the tube after needle insertion, which action is safest first in the occupational health clinic during a clinical simulation? Option A. Leave the needle in place while searching for another vein. Option B. Probe deeply until blood appears. Option C. Turn the needle in circles under the skin. Option D. Gently adjust needle position while staying within policy and patient comfort limits. The correct answer is option D. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. A needle should not be left in one site while searching elsewhere. Deep probing increases pain, hematoma risk, and nerve injury risk. Rotating the needle under the skin is traumatic and not appropriate. Question 9. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do in the blood collection station during a review? Option A. Stop the draw, remove the needle safely, and follow facility procedure. Option B. Release pressure only after all tubes are collected. Option C. Advance deeper to pass the nerve. Option D. Ask the patient to ignore it until the tube fills. The correct answer is option A. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Continuing tube collection delays the response to a possible complication. Advancing deeper can worsen nerve injury. Ignoring the symptom places the patient at unnecessary risk. Question 10. During a difficult draw, why should excessive probing be avoided in the outpatient clinic during a mock exam? Option A. It prevents the need for patient identification. Option B. It increases pain, hematoma risk, and possible nerve or tissue injury. Option C. It improves all specimen results. Option D. It sterilizes the vein. The correct answer is option B. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Patient identification is always required regardless of draw difficulty. Probing does not improve laboratory accuracy. Needle movement has no sterilizing effect. Question 11. If a vein collapses during evacuated tube collection, which change may help on a redraw in the hospital unit during morning rounds during a skills check? Option A. Tell the patient to pump the fist continuously. Option B. Use a stronger vacuum tube on the same fragile vein. Option C. Use a smaller tube, syringe, or winged set according to policy. Option D. Keep the tourniquet on for several minutes. The correct answer is option C. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. Continuous fist pumping may affect analytes and does not solve vein collapse. A stronger vacuum can worsen collapse. Prolonged tourniquet time can alter results and increase discomfort. Question 12. To protect patient safety, which sites should generally be avoided unless specifically approved by policy or provider order in the urgent care laboratory during a practice drill? Option A. A suitable cephalic vein. Option B. A well-palpated median cubital vein. Option C. An acceptable dorsal hand vein. Option D. A foot or ankle vein. The correct answer is option D. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. The cephalic vein can be appropriate when assessed carefully. The median cubital vein is a common routine site when suitable. A dorsal hand vein may be acceptable when antecubital veins are unavailable. Question 13. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture in the pediatric clinic during a scenario? Option A. The fistula must be protected from injury, infection, and altered blood flow. Option B. It eliminates the need for a tourniquet. Option C. The blood in that arm has no cells. Option D. All tubes drawn from that arm turn blue. The correct answer is option A. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Tourniquet decisions do not remove the risk to a fistula. Blood in the arm still contains cells. Tube color is determined by the collection container, not the arm. Question 14. Why is the site of a prior mastectomy often avoided for venipuncture in the long-term care unit during a competency review? Option A. All specimens from that site clot immediately. Option B. Lymphatic changes can increase risk for swelling, infection, or complications. Option C. The veins always contain arterial blood. Option D. The skin cannot be cleaned. The correct answer is option B. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. Specimens do not automatically clot because of collection side. Venous blood does not become arterial because of mastectomy history. The issue is not an inability to cleanse skin. Question 15. When N4 is running in one arm, which collection choice is usually preferred in the mobile collection site during a final review? Option A. Ignore the 4 because additives prevent contamination. Option B. Draw above the 4 site while fluid is running. Option C. Use the opposite arm when available and follow facility policy. Option D. Collect directly through the 4 tubing without authorization. The correct answer is option C. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from 4 fluids. Tube additives do not correct 4 fluid contamination. Drawing above a running 4 can contaminate or dilute the specimen. Line draws require authorization and specific procedure. Question 16. Before proceeding with the draw, which finding makes a venipuncture site a poor choice in the emergency department bay during a study session? Option A. A site that allows safe patient positioning. Option B. A vein that is palpable and resilient. Option C. Clean intact skin over an antecubital vein. Option D. Edema, burns, scarring, or signs of infection at the site. The correct answer is option D. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. Safe positioning is desirable for venipuncture. A palpable resilient vein is generally a favorable finding. Clean intact skin supports safe site preparation. Question 17. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect in the physician office lab during a structured exam prep drill? Option A, hematoma formation. Option B, normal clot retraction in the vein. Option C, proper tube mixing. Option D, successful fasting status. The correct answer is option A. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Clot retraction is a laboratory process, not a normal event around an active needle site. Tube mixing happens after collection and does not cause local swelling. Fasting status cannot be determined by puncture site swelling. Question 18. If a hematoma starts to develop during venipuncture, which action is appropriate in the community health screening event during a clinical simulation? Option A, ask the patient to bend the elbow tightly. Option B, release the tourniquet, remove the needle, and apply pressure. Option C, continue filling all ordered tubes. Option D, massage the swollen area vigorously. The correct answer is option B. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Bending the elbow can increase bruising and does not provide focused pressure. Continuing the draw can enlarge the hematoma. Vigorous massage can worsen bruising and tissue injury. Question 19. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the preoperative testing area during a review? Option A, give the patient food before removing the needle. Option B, ask the patient to stand up and walk it off. Option C, stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option D, leave the needle in while getting more tubes. The correct answer is option C. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Food is not the first action while a needle is still in the arm. Standing can lead to a fall. Leaving the needle in place while symptoms progress increases injury risk. Question 20. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the oncology infusion center during a mock exam? Option A, use the same bandage time for every patient without checking. Option B, skip pressure to avoid bruising. Option C, ask the patient to bend the elbow sharply. Option D, apply firm pressure longer and verify bleeding has stopped before bandaging. The correct answer is option D. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. A fixed time without checking may miss ongoing bleeding. Skipping pressure increases bleeding risk. Bending the elbow can promote bruising instead of controlled pressure. Question 21. After reviewing the order, which action helps prevent a hematoma after removing the needle in the dialysis adjacent clinic during a skills check? Option A, apply clean gauze with firm pressure while the arm remains straight. Option B, remove the needle before releasing the tourniquet every time. Option C, have the patient bend the elbow tightly. Option D, rub the puncture site to spread the blood. The correct answer is option A. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Bending the elbow may increase leakage into tissue. Rubbing can disrupt clot formation and worsen bruising. Question 22. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the student skills lab during a practice drill? Option A, normal capillary refill. Option B, possible arterial puncture. Option C, proper venous flow. Option D, tube additive carryover. The correct answer is option B. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Capillary refill is assessed in tissue color return, not tube blood flow. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Question 23. In a routine phlebotomy scenario, which tube is collected first when blood cultures are ordered with other venipuncture tubes in the occupational health clinic during a scenario? Option A, serum separator tube. Option B, lavender EDTA tube. Option C, blood culture bottles or sterile culture tube. Option D, gray fluoride tube. The correct answer is option C. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. Serum separator tubes do not take priority over sterile blood culture collection. EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Question 24. In the standard venipuncture order of draw, which tube usually follows blood cultures in the blood collection station during a competency review? Option A, royal blue tube for every test. Option B, lavender EDTA tube. Option C, gray fluoride tube. Option D, light blue sodium citrate tube. The correct answer is option D. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. Royal blue tubes are used for specific trace element testing, not as the universal second tube. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Question 25. During a final review, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes? Option A, blood cultures, light blue, serum, green, lavender, gray. Option B, serum, lavender, blood cultures, gray, light blue, green. Option C, lavender, gray, green, serum, light blue, blood cultures. Option D, gray, lavender, green, serum, light blue, blood cultures. The correct answer is option A. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Placing cultures after non-sterile tubes increases contamination risk. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Question 26. Why does order of draw matter during evacuated tube collection in the hospital unit during morning rounds during a study session? Option A. It determines the patient's fasting status. Option B. It helps prevent additive carryover from altering later specimens. Option C. It makes patient identification optional. Option D. It eliminates the need to mix tubes. The correct answer is option B. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Fasting status is based on patient preparation, not tube sequence. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Question 27. During capillary puncture, which specimen type is generally collected first when ordered in the urgent care laboratory during a structured exam prep drill? Option A, non-additive tube after all others. Option B, serum specimen. Option C, blood gas specimen. Option D, gray top microtube. The correct answer is option C. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Non-additive tubes are not automatically collected first in capillary order. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Question 28. To protect patient safety, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the pediatric clinic during a clinical simulation? Option A. Any order because capillary tubes have no additives. Option B. Serum microtube before EDTA for every draw. Option C. Gray microtube first even when blood gases are needed. Option D. EDTA microtube before other additive and serum microtubes. The correct answer is option D. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Many capillary tubes contain additives, so order still matters. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time sensitive and generally come first if ordered. Question 29. After reviewing the order, which tube is most appropriate for a routine CBC in the long-term care unit during a review? Option A. Lavender top tube containing EDTA. Option B. Red no additive tube. Option C. Light blue sodium citrate tube. Option D. Gray sodium fluoride tube. The correct answer is option A. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. A red tube allows serum testing and is not the standard choice for CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. Question 30. When preparing for collection, which additive is found in a light blue tube used for patient NHACPT testing in the mobile collection site during a mock exam? Option A. Lithium heparin. Option B. Sodium citrate. Option C. EDTA. Option D. Sodium fluoride with potassium oxalate. The correct answer is option B. Sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Question 31. In a routine phlebotomy scenario, which tube is commonly selected for many serum chemistry tests when gel separation is desired in the emergency department bay during a skills check? Option A. Gray fluoride tube only. Option B. Lavender EDTA tube. Option C. Serum separator tube with clot activator and gel. Option D. Light blue citrate tube. The correct answer is option C. Serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. Gray tubes preserve glucose but are not the general serum separator choice. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Question 32. Before proceeding with the draw, which tube is commonly associated with heparinized plasma chemistry testing in the physician office lab during a practice drill? Option A. Pink top tube. Option B. Lavender top tube. Option C. Light blue top tube. Option D. Green top tube. The correct answer is option D. Green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Question 33. During a scenario, which tube is most commonly used for glucose preservation when testing may be delayed? Option A. Gray top tube with sodium fluoride and an anticoagulant. Option B. Blood culture bottle. Option C plain red tube only. Option D light blue citrate tube. The correct answer is option A. Gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. Blood culture bottles are for detecting microorganisms, not preserving glucose. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Question 34. In the preoperative testing area, which tube is commonly used for blood bank testing such as type and screen? Option A green heparin tube for every blood bank test. Option B pink top EDTA tube. Option C gray top fluoride tube. Option D light blue citrate tube. The correct answer is option B. Pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Green heparin tubes are not the routine tube for type and screen. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Question 35. For a lactate collection, which tube is generally collected for a blood culture specimen? Option A SST after clotting. Option B lavender EDTA tube only. Option C sterile blood culture bottle or SBS containing culture tube according to policy. Option D gray fluoride tube. The correct answer is option C. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. An SST is for serum separation, not microorganism culture. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. Question 36. Why must a light blue citrate tube be filled to the proper level in the dialysis adjacent clinic during a study session? Option A serum cannot clot unless the tube is full. Option B. The tube color changes if underfilled. Option C EDTA needs extra room to mix. Option D. The blood to anticoagulant ratio must be correct for coagulation results. The correct answer is option D. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Question 37. After collecting an additive tube, how should it usually be mixed in the student skills lab during a structured exam prep drill? Option A gently invert the tube the recommended number of times. Option B open the stopper and stir with a wooden applicator. Option C shake it hard until bubbles appear. Option D leave it unmixed until centrifugation. The correct answer is option A. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Opening a tube risks exposure, contamination, and specimen loss. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Question 38. When preparing for collection, which problem can occur if a lavender EDTA tube is not mixed soon after filling in the occupational health clinic during a clinical simulation? Option A. The sodium citrate ratio improves. Option B microclots may form and make hematology results unreliable. Option C. The tube becomes sterile for culture. Option D. The specimen turns into serum. The correct answer is option B. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Sodium citrate is not the additive in a lavender EDTA tube. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Question 39. In a routine phlebotomy scenario, which practice helps reduce hemolysis during a routine blood culture collection? Option A. Pull back a syringe plunger as hard as possible. Option B. Force blood rapidly through a small needle. Option C. Use appropriate needle size and gently invert tubes instead of shaking them. Option D. Shake additive tubes vigorously. The correct answer is option C. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Excessive syringe force can rupture cells and compromise results. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Question 40. Before proceeding with the draw, which laboratory result is especially affected by hemolysis because red cells release intracellular contents? Option A. Tourniquet pressure becomes lower. Option B. Patient date of birth becomes invalid. Option C. Tube expiration date is extended. Option D. Potassium may be falsely increased. The correct answer is option D. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Question 41. When using a syringe for blood transfer, which method best protects specimen quality in the hospital unit during morning rounds during a skills check? Option A. Use a safety transfer device and allow blood to flow gently into tubes. Option B. Shake each tube hard to remove clots. Option C. Remove the tube stopper and push blood in forcefully. Option D. Squirt blood through the needle into each tube. The correct answer is option A. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Shaking tubes can rupture cells and worsen specimen quality. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Question 42. Why should alcohol be allowed to dry before puncture in the urgent care laboratory during a practice drill? Option A. Alcohol drying replaces tourniquet use. Option B. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option C. Dry alcohol makes the tube additive stronger. Option D. Wet alcohol improves vein anchoring. The correct answer is option B. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Tourniquet use is a separate step for vein distension. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Question 43. For a troponin collection, which specimen often requires protection from light after collection? Option A. Blood culture bottle during incubation. Option B. CBC specimen for platelet count. Option C. bilirubin specimen. Option D. Routine sodium citrate coagulation tube. The correct answer is option C. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Question 44. To protect patient safety, which specimen commonly requires rapid transport on ice or chilled handling according to policy? Option A. Blood culture bottle placed in the freezer. Option B. Routine CBC kept for the next day. Option C. Serum separator tube for a lipid panel after clotting only. Option D, ammonia specimen. The correct answer is option D, ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. Blood culture bottles should not be frozen because organisms must remain viable for detection. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Question 45. After reviewing the order, which action best maintains specimen integrity during transport to the laboratory? Option A, follow required time, temperature, light, and handling instructions for the ordered test. Option B, place all blood specimens in direct sunlight. Option C, store every specimen at room temperature overnight. Option D, centrifuge every tube immediately regardless of type. The correct answer is option A. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Sunlight can degrade light-sensitive analytes and warm specimens. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Question 46. If a specimen must be transported cold, which approach is appropriate in the emergency department bay during a study session? Option A, place it near a heater until pickup. Option B, place the specimen in the approved cooling method without direct water contamination. Option C, submerge the tube in loose ice water. Option D, hold it in a bare hand to keep it visible. The correct answer is option B. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. A heater can destabilize temperature-sensitive analytes. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. Question 47. In a routine phlebotomy scenario, which situation is a common reason for specimen rejection? Option A, tube was labeled at the bedside. Option B, collector wore gloves. Option C, wrong tube type or insufficient specimen volume. Option D, patient stated date of birth. The correct answer is option C. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Bedside labeling is the correct practice. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Question 48. Why should tube expiration dates be checked before collection in the community health screening event during a clinical simulation? Option A, expired tubes are required for coagulation testing. Option B, expired tubes identify patients faster. Option C, expired tubes prevent hemolysis in every case. Option D, expired tubes may have inadequate vacuum or unreliable additive performance. The correct answer is option D. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Coagulation testing requires properly filled, unexpired citrate tubes. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Question 49. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the preoperative testing area during a review? Option A, follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Option B, cancel every test without notifying anyone. Option C, draw the specimen and write fasting on the label. Option D, tell the patient not to mention the meal. The correct answer is option A. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Canceling without communication may disrupt care and exceed the phlebotomist's role. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Question 50. Why is fasting status important before some chemistry tests in the Oncology Infusion Center during a mock exam? Option A. Fasting eliminates the need for tube mixing. Option B. Food intake can alter analytes such as glucose or lipids. Option C. Food changes the patient's legal name. Option D. Fasting makes needles sterile. The correct answer is option B. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Additive tubes still require proper mixing regardless of fasting status. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Question 51. For a medication trough level, when is the specimen usually collected in the dialysis adjacent clinic during a skills check? Option A. Only after the medication is discontinued for a week. Option B. Immediately after the medication is swallowed. Option C. Immediately before the next scheduled dose. Option D. At any random time during the day. The correct answer is option C. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Stopping medication for a week is not the routine way to collect a trough. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Question 52. During a glucose tolerance test, why must collection times be followed carefully in the student skills lab during a practice drill? Option A. The patient should eat between timed draws to stay comfortable. Option B. Any time is acceptable if the tubes are gray. Option C. Timing only matters after the last tube. Option D. Timed results show how the body responds to a measured glucose dose. The correct answer is option D. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Eating during the test can invalidate the glucose response pattern. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Question 53. After reviewing the order, which documentation is especially important for a timed specimen? Option A. Exact collection time recorded on the label or requisition according to policy. Option B. A note saying collected sometime today. Option C. The phlebotomist's favorite tube brand. Option D. Only the patient's room number. The correct answer is option A. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Vague timing can make the specimen clinically unreliable. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Question 54. For a legal blood alcohol collection, which requirement is especially important in the blood collection station during a competency review? Option A. Let the patient carry the open tube to the lab. Option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Option C. Use alcohol swabs for every blood alcohol specimen. Option D. Leave the specimen unlabeled until court. The correct answer is option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Allowing the patient to carry an open specimen compromises custody and security. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Question 55. In a routine phlebotomy scenario, which action best supports chain of custody for a drug screen specimen in the outpatient clinic during a final review? Option A. Discard the seal after collection. Option B. Use only verbal handoff with no signatures. Option C. Document each person who handles the specimen from collection to transfer. Option D. Store the specimen in an unlocked public area. The correct answer is option C. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. A broken or discarded seal weakens evidence of tamper control. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. Question 56. Why are tamper-evident seals used on forensic or workplace testing specimens in the hospital unit during morning rounds during a study session? Option A. They prevent the need for a requisition. Option B. They replace patient consent. Option C. They make refrigeration unnecessary for all tests. Option D. They help show whether the specimen was opened or altered after collection. The correct answer is option D. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A requisition or custody form is still needed for proper processing. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. Question 57. For an infant heel stick, which area is safest for puncture in the urgent care laboratory during a structured exam prep drill? Option A. Medial or lateral plantar surface of the heel. Option B. Tip of the great toe. Option C. Posterior curvature of the heel. Option D. Center of the arch. The correct answer is option A. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The great toe is not the standard infant heel stick site. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. Question 58. Why should an infant heel puncture not be too deep in the pediatric clinic during a clinical simulation? Option A. A deep puncture replaces the need for warming. Option B. Excessive depth can injure bone or deeper tissue. Option C. A deeper puncture always prevents hemolysis. Option D. Depth determines the tube color. The correct answer is option B. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Warming is a separate step used to improve blood flow when appropriate. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Question 59. For a thyroid panel collection, which finger is generally preferred for adult capillary puncture? Option A. Little finger near the bone. Option B. Thumb pad for every test. Option C. Middle or ring finger on the palmar surface near the side of the fingertip. Option D. Index fingertip in all adults. The correct answer is option C. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The little finger has less tissue over bone and higher injury risk. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. Question 60. After a finger puncture, why is the first drop of blood commonly wiped away in the mobile collection site during a mock exam? Option A. It activates the tube vacuum. Option B. It contains only white blood cells. Option C. It proves the patient is fasting. Option D. It may contain tissue fluid or contaminants that can affect the specimen. The correct answer is option D. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. Capillary collection does not depend on evacuated tube vacuum at the puncture site. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Question 61. How can warming a capillary puncture site help collection in the emergency department bay during a skills check? Option A. It increases local blood flow when used safely. Option B. It makes every specimen suitable for culture. Option C. It sterilizes the skin completely. Option D. It removes the need to identify the patient. The correct answer is option A. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Capillary specimens are not automatically suitable for blood culture collection. Warming does not sterilize skin. Patient identification is still mandatory. Question 62. Why should excessive squeezing or milking be avoided during capillary collection in the physician office lab during a practice drill? Option A. It prevents clotting in serum tubes. Option B. It can dilute the specimen with tissue fluid and cause hemolysis. Option C. It improves all glucose results. Option D. It makes EDTA unnecessary. The correct answer is option B. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Serum tubes are intended to clot and are not protected by squeezing. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Question 63. When is dermal puncture commonly preferred over venipuncture in the community health screening event during a scenario? Option A. Whenever patient identification is incomplete. Option B. For every blood culture set. Option C. For some infants, small volume tests, or patients with difficult veins when appropriate. Option D. For all coagulation studies regardless of policy. The correct answer is option C. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Incomplete identification must be resolved before any collection method. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Question 64. A child begins to pull away during a draw. Which action supports safety in the preoperative testing area during a competency review? Option A. Ask another child to hold the arm. Option B. Continue while the arm is moving. Option C. Scold the child until they stop. Option D. Pause if needed and obtain appropriate assistance for safe positioning according to policy. The correct answer is option D. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Another child is not appropriate assistance for a procedure. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Question 65. During a final review, which explanation is best for a young child before a finger stick in the oncology infusion center during a final review? Option A. Use simple honest words such as a quick pinch and explain what they can do to help. Option B. Promise a toy only if they do not cry. Option C. Tell the child nothing will happen. Option D. Use detailed adult medical terminology. The correct answer is option A. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Tying a reward to not crying can shame a normal fear response. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Question 66. For an older adult with fragile veins, which technique is most appropriate in the dialysis-adjacent clinic during a study session? Option A. Leave the tourniquet on for several minutes. Option B. Use gentle anchoring and consider a smaller needle or controlled collection device. Option C. Slap the site hard to make veins appear. Option D. Use the largest needle available. The correct answer is option B. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Prolonged tourniquet time increases hemoconcentration and bruising risk. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Question 67. Why should adhesive bandages be used carefully on some older adults in the student skills lab during a structured exam prep drill? Option A. Bandages prevent all anticoagulant bleeding. Option B. Adhesive changes the blood type. Option C. Fragile skin can tear when adhesive is removed. Option D. Older adults never need pressure after draws. The correct answer is option C. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. A bandage does not eliminate bleeding risk, especially with anticoagulants. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. Question 68. Before assembling equipment for a basic metabolic panel draw, which item should be checked in the occupational health clinic during a clinical simulation? Option A. The brand of wall clock in the room. Option B. Only the color of the chair. Option C. The patient's favorite beverage. Option D. Tube type, expiration date, needle safety device, and requisition requirements. The correct answer is option D. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. The wall clock brand does not confirm correct supplies or orders. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. Question 69. After reviewing the order, which sequence is safest after blood has entered the final tube in the blood collection station during a review? Option A. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option B. Remove the needle and recap it before pressure. Option C. Withdraw needle with tourniquet tight and no gauze ready. Option D. Activate safety device before removing the needle from the arm. The correct answer is option A. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Recapping a contaminated needle creates sharp's injury risk. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Question 70. When preparing for collection, which action should occur before leaving the patient after venipuncture in the outpatient clinic during a mock exam? Option A. Dispose of sharps after walking to another room. Option B. Confirm bleeding has stopped and provide appropriate post-draw instructions. Option C. Leave while blood is still oozing. Option D. Tell the patient to remove the bandage immediately. The correct answer is option B. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Sharps must be disposed of promptly in the collection area. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Question 71. Why is patient positioning important before venipuncture in the hospital unit during morning rounds during a skills check? Option A. It allows the needle to be reused safely. Option B. It makes labeling unnecessary. Option C. It reduces the risk of falls or injury if the patient becomes dizzy. Option D. It changes EDTA into citrate. The correct answer is option C. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Needles are single-use and cannot be reused. Proper positioning does not replace specimen labeling. Body position does not change tube additives. Question 72. Before proceeding with the draw, which patient instruction is appropriate after a routine venipuncture in the urgent care laboratory during a practice drill? Option A. Bend the elbow tightly for 10 minutes. Option B. Scratch the site if it feels itchy. Option C. Remove the bandage while still bleeding. Option D. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. The correct answer is option D. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Bending the elbow tightly can increase bruising. Scratching can disrupt the site and introduce contamination. Removing a bandage during bleeding can restart or worsen bleeding. Question 73. During a scenario, which laboratory department commonly performs CBC testing in the pediatric clinic during a scenario? Option A. Hematology. Option B. Histology only. Option C. Microbiology only. Option D. Blood bank only. The correct answer is option A. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Histology focuses on tissue specimens rather than routine CBC testing. Microbiology focuses on organisms and cultures. Blood bank focuses on compatibility and transfusion-related testing. Question 74. In the long-term care unit, which department usually performs patient and APTT coagulation testing? Option A. Cytology screening only. Option B. Coagulation or hematology coagulation section. Option C. Urinalysis only. Option D. Microbiology culture bench only. The correct answer is option B. Coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Cytology examines cells for diagnostic changes, not standard coagulation studies. Urinalysis focuses on urine specimens. Microbiology culture benches identify organisms rather than routine clotting times. Question 75. For a hemoglobin A1C collection, which department is most associated with blood cultures? Option A. Chemistry electrolyte analysis only. Option B. Blood bank compatibility only. Option C. Microbiology. Option D. Histology tissue processing. The correct answer is option C. Microbiology. Microbiology processes cultures to detect and identify microorganisms. Chemistry analyzes chemical constituents and is not the main culture department. Blood bank testing focuses on transfusion compatibility. Histology processes tissue rather than blood culture bottles. Question 76. To protect patient safety, which department commonly performs type and screen testing in the emergency department bay during a study session? Option A. Parasitology stool testing only. Option B. Microbiology only. Option C. Chemistry only. Option D. Blood bank or transfusion services. The correct answer is option D. Blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Parasitology stool testing does not perform transfusion compatibility testing. Microbiology focuses on infectious organisms. Chemistry focuses on analytes such as glucose and electrolytes. Question 77. After reviewing the order, which department commonly analyzes electrolytes such as sodium and potassium in the physician office lab during a structured exam prep drill? Option A. Chemistry. Option B cytogenetics only. Option C histology. Option D blood bank compatibility bench. The correct answer is option A. Chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Histology focuses on tissues. Blood bank compatibility testing is not the routine electrolyte section. Question 78. When preparing for collection, which practice is part of phlebotomy quality assurance in the community health screening event during a clinical simulation? Option A skipping competency checks for experienced staff. Option B tracking specimen errors and using corrective action to prevent recurrence. Option C ignoring mislabeled specimens if the patient is well known. Option D changing tube labels after results are reported. The correct answer is option B. Tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Competency checks help maintain consistent safe practice for all staff. Familiarity with a patient does not make a mislabeled specimen acceptable. Changing labels after reporting hides errors and compromises traceability. Question 79. Why are competency assessments important for phlebotomists in the preoperative testing area during a review? Option A. They are only for patients who complain. Option B. They replace all written procedures. Option C. They verify that staff can perform required skills safely and consistently. Option D. They allow staff to ignore order of draw. The correct answer is option C. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Competency is a proactive quality process, not only a reaction to complaints. Written procedures are still needed as standards for practice. Order of draw remains important regardless of competency status. Question 80. Before proceeding with the draw, which error should be reported through the facility's quality process in the Oncology Infusion Center during a mock exam? Option A. A needle safety device is activated after use. Option B. A patient correctly states their date of birth. Option C. A tube is mixed according to instructions. Option D. A specimen collected in the wrong tube type. The correct answer is option D. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Activating a safety device after use is the intended safety behavior. Correct identity confirmation is expected practice, not an error. Proper tube mixing supports quality. Question 81. During a skills check, which activity is commonly associated with CLIA waived point of care testing in the dialysis adjacent clinic during a skills check? Option A. Following manufacturer instructions and documenting quality control for a simple approved test. Option B. Using expired test strips because they look normal. Option C. Changing the test procedure to save time. Option D. Reporting results without controls when controls are required. The correct answer is option A. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Expired strips may produce inaccurate results even if they look acceptable. Modifying the procedure can invalidate the test category and results. Skipping required controls undermines result reliability. Question 82. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the student skills lab during a practice drill? Option A. Apply disinfectant and test before the site dries. Option B. Confirm test strip expiration and run required quality control according to policy. Option C. Use a strip from an unlabeled loose container. Option D. Skip patient identification because the device stores results. The correct answer is option B. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Testing before the site dries can contaminate or dilute the sample. Loose unlabeled strips may be expired or contaminated. Device storage does not replace identifying the patient. Question 83. Why must abnormal point-of-care results be handled according to facility policy in the occupational health clinic during a scenario? Option A. The patient should interpret the result without staff involvement. Option B. Abnormal results should always be erased. Option C. Critical or unexpected results may require confirmation, documentation, or immediate notification. Option D. Only normal results belong in the medical record. The correct answer is option C. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Erasing abnormal results hides clinically important information. Both normal and abnormal results may require documentation. Question 84. To protect patient safety, which blood component is primarily responsible for carrying oxygen in the blood collection station during a competency review? Option A. Tube separation gel. Option B. Sodium citrate in plasma. Option C. Platelet granules only. Option D. Hemoglobin inside red blood cells. The correct answer is option D. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Separation gel is part of a tube system, not a blood component. Sodium citrate is a tube additive, not an oxygen carrier. Platelets help hemostasis but do not primarily transport oxygen. Question 85. After reviewing the order, which blood component is most directly involved in forming the initial platelet plug in the outpatient clinic during a final review? Option A. Platelets. Option B. Chloride ions. Option C. Albumin only. Option D. Glucose molecules. The correct answer is option A. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Chloride is an electrolyte and does not form platelet plugs. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Glucose is an energy source, not a clotting cell fragment. Question 86. When preparing for collection, which vessel type is normally used for routine venipuncture in the hospital unit during morning rounds during a study session? Option A. Tendon sheath. Option B. Vein. Option C. Artery. Option D. Lymphatic duct. The correct answer is option B. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. A tendon sheath is not a blood vessel and must be avoided. Arterial puncture is a different procedure and not routine venipuncture. Lymphatic ducts do not provide venous blood specimens. Question 87. Why is the basilic vein approached with extra caution in the urgent care laboratory during a structured exam prep drill? Option A. It cannot be palpated in any patient. Option B. It contains no venous blood. Option C. It lies near nerves and arteries in the antecubital area. Option D. It always has a built-in tourniquet. The correct answer is option C. It lies near nerves and arteries in the antecubital area. The basilic area has nearby structures that increase the consequence of poor needle placement. The vein may be palpable, but caution is still needed because of anatomy. The basilic vein does contain venous blood. No vein has a built-in tourniquet. Question 88. Before proceeding with the draw, which term describes stopping bleeding after vessel injury? Option A, hemoconcentration. Option B, hemolysis. Option C, glycolysis. Option D, hemostasis. The correct answer is option D, hemostasis. Hemostasis is the process that stops bleeding through vascular response, platelets, and coagulation. Hemoconcentration is increased concentration of blood components from fluid shifts. Hemolysis is red cell rupture. Glycolysis is glucose metabolism by cells. Question 89. A clotted lavender tube is received for CBC testing. Why is recollection usually needed in the long-term care unit during a review? Option A, clots trap cells and make cell counts unreliable. Option B, lavender tubes are supposed to clot before testing. Option C, clotting proves the patient was fasting. Option D, clots improve automated CBC accuracy. The correct answer is option A. Clots trap cells and make cell counts unreliable. CBC testing requires a well-mixed anticoagulated specimen so cells remain evenly suspended. Lavender tubes contain EDTA and should not clot when properly mixed and filled. Fasting status is unrelated to clot formation in an EDTA tube. Clots can block analyzers or distort cell counts. Question 90. An underfilled light blue tube arrives for patient testing. What is the main concern in the mobile collection site during a mock exam? Option A. The patient's identity becomes verified. Option B, excess citrate relative to blood may alter coagulation results. Option C. The specimen will become a blood culture. Option D. The tube will automatically refill in the lab. The correct answer is option B. Excess citrate relative to blood may alter coagulation results. Underfilling changes the anticoagulant to blood ratio and can make coagulation results inaccurate. Fill volume has no role in verifying identity. A citrate tube cannot become a blood culture bottle. Tubes do not refill after collection. Question 91. For a electrolyte panel collection, which additive can falsely increase potassium if carried into a chemistry tube? Option A, sterile culture broth only. Option B, clot activator gel only. Option C, potassium EDTA. Option D, sodium fluoride without potassium. The correct answer is option C. Potassium EDTA. Potassium EDTA carryover can contaminate chemistry specimens and falsely elevate potassium while lowering calcium. Culture broth is used for organism recovery and is not the classic potassium carryover problem. Gel itself does not add potassium in the same way EDTA contamination does. Sodium fluoride is associated with glucose preservation, not potassium EDTA effects. Question 92. To protect patient safety, which tube should generally be collected before a lavender EDTA tube in venipuncture order in the physician office lab during a practice drill? Option A. No tube because EDTA always comes first. Option B, gray fluoride tube after lavender only. Option C. Another lavender tube for every test. Option D, green heparin tube. The correct answer is option D. Green heparin tube. In the standard sequence, heparin tubes are collected before EDTA tubes to limit additive carryover effects. EDTA does not always come first and can interfere with later tests. Gray tubes generally follow EDTA, not precede it as the key before lavender tube. Collecting another lavender tube does not answer the order requirement. Question 93. After reviewing the order, which instruction is commonly given for a fasting blood test unless policy says otherwise in the community health screening event during a scenario? Option A, avoid food and most beverages except water for the required fasting period. Option B, eat a small snack because it will not matter. Option C, drink sugary beverages before arrival. Option D, chew gum with sugar during the fast. The correct answer is option A. Avoid food and most beverages except water for the required fasting period. Fasting helps standardize results for tests affected by recent food intake. A snack can invalidate fasting status for tests that require it. Sugary beverages can alter glucose and other chemistry results. Sugared gum can break the fast for some testing instructions. Question 94. If a timed specimen is collected late, which action is most appropriate in the preoperative testing area during a competency review? Option A. Change the patient's medication schedule independently. Option B. Document the actual collection time and notify the appropriate person according to policy. Option C. Write the scheduled time on the label anyway. Option D. Discard the requisition without telling anyone. The correct answer is option B. Document the actual collection time and notify the appropriate person according to policy. Actual collection time is necessary to interpret timed results and decide whether recollection is needed. Medication timing decisions are outside routine phlebotomy authority. Writing the scheduled time is inaccurate documentation. Discarding the order without communication disrupts care. Question 95. In a routine phlebotomy scenario, which behavior is outside appropriate phlebotomy scope in a routine collection setting? Option A. Reporting a specimen problem to the supervisor. Option B. Verifying patient identity. Option C. Interpreting the diagnosis and changing the provider's order independently. Option D. Labeling the specimen at the bedside. The correct answer is option C. Interpreting the diagnosis and changing the provider's order independently. Phlebotomists collect and handle specimens but do not independently diagnose or alter provider orders. Reporting problems supports patient safety and quality assurance. Identity verification is a core phlebotomy responsibility. Bedside labeling is expected practice. Question 96. A patient asks when results will be ready. Which response is most appropriate in the dialysis adjacent clinic during a study session? Option A. Tell the patient results are not their concern. Option B. Guess a diagnosis from the tube color. Option C. Promise exact results in 5 minutes for every test. Option D. Explain that the laboratory or provider will report results according to facility process. The correct answer is option D. Explain that the laboratory or provider will report results according to facility process. The phlebotomist can provide general process information without interpreting or promising results outside their role. Dismissive language is unprofessional and does not support patient-centered care. Tube color does not allow diagnosis. Turnaround time varies by test and setting, so a universal promise is unsafe. Question 97. During a structured exam prep drill, which disposal choice is correct for blood-soaked gauze after a draw? Option A. Place it in the appropriate biohazard waste container according to policy. Option B. Hand it to the next patient to hold. Option C. Place it in the sharps container. Option D. Put it in a clean supply drawer. The correct answer is option A. Place it in the appropriate biohazard waste container according to policy. Blood-contaminated soft waste belongs in the designated biohazard stream when required by policy. Giving contaminated gauze to another patient creates exposure risk. Sharps containers are reserved for needles and other sharps, not soft gauze. A supply drawer must remain clean and uncontaminated. Question 98. In the occupational health clinic, which item should never be stored with clean blood collection supplies? Option A. Clean tourniquets ready for use. Option B. Used needles or blood-contaminated materials. Option C. Unopened sterile needles. Option D. Unexpired evacuated tubes. The correct answer is option B. Used needles or blood-contaminated materials. Clean supplies must be protected from contamination to prevent patient exposure and specimen problems. Clean tourniquets can be stored for patient use if facility policy permits. Unopened sterile needles are appropriate clean supplies when stored correctly. Unexpired tubes belong with clean collection inventory. Question 99. Why should a phlebotomist follow the facility procedure manual rather than personal shortcuts in the blood collection station during a review? Option A, regulations do not apply to outpatient settings. Option B, shortcuts are always faster and safer. Option C, standard procedures support consistent safety, quality, and regulatory compliance. Option D, procedure manuals are only for new employees. The correct answer is option C. Standard procedures support consistent safety, quality, and regulatory compliance. Written procedures create a consistent standard that reduces variation and errors. Regulatory and safety expectations apply across collection settings. Shortcuts can bypass safety checks and increase risk. Experienced staff are also expected to follow current procedures. Question 100. To protect patient safety, which action helps prevent leakage during specimen transport? Option A, place tubes loose in a coat pocket. Option B, loosen the stopper to release pressure. Option C, carry open tubes by hand. Option D, ensure the tube is closed securely and placed in approved transport packaging. The correct answer is option D. Ensure the tube is closed securely and placed in approved transport packaging. Secure closure and proper packaging protects staff, couriers, and specimen integrity. A coat pocket is not approved specimen transport packaging. Loosening the stopper can cause leaks and exposure. Open tubes increase spill and contamination risk.